our across the aisle segment tonight. California state senators just passed a single-payer health care bill. Now they have to figure out how they would pay for the $400 billion price tag. But with businesses already fleeing California for conservative states, where do they expect that money to come from? With me now, history professor and author of Obama's America, a transformative vision of our national identity, Ian Reifowitz. Ian, good to see you.
Good to be back, Liz.
All right, Ian, let's just get right into this. $400 billion, that's a lot of money, particularly for one state, even a state as large as California. How exactly is the state of California going to pay for that?
Well, you have to remember, you're talking about a huge pot of money that is already being spent on healthcare. So I looked into this a bit. You're talking about $400 billion. Another estimate had it closer to about $330 billion, but that's fine either way. What you're talking about doing is taking approximately $200 billion that's already being spent in California by the state and local government and shifting that right into the program. So that's a big chunk of what you're talking about already. Second, you've got to remember that when if this program is passed, nobody will spend a dime any longer on health insurance premiums or co-pays or deductibles. So that's where the rest of the money comes in. You're talking about paying for healthcare in a different way. It's not going to cost any more money. It's just that instead of paying for premiums, deductibles, and co-pays, people will just have healthcare paid for through the tax system. So it's a different way of doing it. That's what single payer is.
Yeah, I've heard the argument that it won't be $400 billion a year. I'm not sure that that's going to be the case, but accepting that premise for a moment, I mean, even if that $200 billion was shifted away from the healthcare industry that we have now to the government-run healthcare system, the single-payer system that they're proposing, it would still leave at the very, very least, and this is a generous estimate, at least $50 to $100 billion tab every year. And I guess my question, I mean, you say that we wouldn't have to pay for premiums or deductibles or co-pays. Is that how it works in other single-payer healthcare systems, that they never have to pay anything for their own health care?
Well, it depends on the system, but the California bill is a very expansive bill. It's more expansive than I think we see in some of the other countries around the world, although it's not that different from some. But the point is that the rest of that money is already being spent. So it's a matter of, think of it like this. If you're a family, what would you rather do? Would you rather have a $1,000 tax bill and spend another $1,000 on health care? Or would you rather have a $1,500 tax bill for health care and spend no other money? I'd rather spend $1,500 even if all of it's going through the government system, than spend $2,000 with half of it going to taxes and half of it going to private health care.
I guess I'd rather spend as little as possible on taxes and make my own healthcare decisions. I guess my point is, I mean, if you look at countries around the world that have single-payer healthcare or socialized healthcare, whatever you want to call it, I mean, where exactly do people not end up spending money outside of the governmental system? In Cuba, anybody who wanted good quality healthcare had to go outside of the governmental system. In the UK, anybody who wants good quality healthcare has to go outside of the governmental system. In France, 90% of their citizens have supplemental health insurance in addition to what they have from the government, which is supposed to be enough. We see that in Sweden as well. In Canada, people come to the United States. I mean, realistically, if we look to history, you're a history professor, you know we learn our lessons from history. It hasn't worked.
I'm sorry, Liz, to tell you this, but it actually has worked, and it's worked exceptionally well in the rest of the developed world and quite poorly in the United States. You can look at all of the health statistics that show we get worse health results overall, lower life expectancy, any number of other measures. We have a worse rating than the other industrialized countries, and we spend from 1/3 to twice as much more per capita on healthcare. There hasn't been a single country that's gone to a national healthcare system that's gone back away from it.
Wait a second. I want to ask you, why is our life expectancy rate, when you talk about life expectancy being worse, and this is a classic liberal talking point here, why is our rate, worse than other developed Western nations?
Well, presumably, and if you want to look at healthcare as being one factor, I wouldn't say our healthcare system is the only factor, but you have in this country, until the introduction of Obamacare, millions and millions of people who needed health insurance, who needed health coverage and couldn't get it.
No, that's not why.
That's one aspect.
That's not why. That's not where that number came from. The number came from, and again, this is a liberal talking point. They created this number to serve their political agenda. It's because they include things like homicides and people who die instantly in high-speed car crashes, in that life expectancy rate when those are two things that are not impacted by health care. There's nothing health care coverage can do if you're murdered. There's nothing health care coverage can do if you're instantly killed in a car crash. No other developed Western nations includes those two statistics in their life expectancy rate. When you remove those two factors from our life expectancy rate, it's actually higher than other nations. So that in and of itself completely debunked liberal talking point. But again, just going back to for a second to the amount of money that this is going to cost in California, given, like I said, let me accept the premise that it'll be $100 billion. Where do you expect to get that money? These legislators don't even have a plan of where they're going to get that.
First of all, I said that healthcare was one factor. I didn't say it was the only factor. And the statistics come from the World Health Organization, and I have to tell you that they do apples to apples comparisons. If we have a higher murder rate, given that we have more strict that we have looser gun laws, then maybe we need to revisit those gun laws and ask whether those looser gun laws are what's causing the higher murder rate. But to get back to California, you're talking about a very preliminary part in the process, a very preliminary step. They will have to come up with an idea of how they're going to rejigger the cost, whether it's some kind of tax. But a study done on this new health care bill coming out of California that was sponsored by the California Nurses Association and the National Nurses United found that not only would households save money, but businesses would save money as well, because they wouldn't need to provide health insurance anymore for their employees. So it actually is something that would liberate
businesses are going to move out of
businesses.
California. I mean, this is just common sense. I don't understand what the people in Sacramento, what our elected officials in this state that I live in, what they're possibly thinking. Businesses are going to move out of California. Rich people who get hit with these taxes, this broad-based revenue that the legislators are talking about, they're going to leave the state. So rich people aren't going to be rich anymore. And who's that going to fall on? It's going to fall on the back of the middle class, as things always do. I'm shocked, frankly, Ian, that liberals are supporting the idea of passing such a massive spending bill without having any way to fund it. It's asinine. It's ridiculous. But I appreciate you coming on the show and talking about it.